trauma, herniotomy, gonorrhea, urogenital TBC, chronic prostatitis, urethritis, strong smoker, alcoholism, varicocele or hydrocele operations. Our treatment plan for male infertility is with power cells, long-term but smooth, I always must repeat it, 6 injections per week, brain, heart, adrenal gland, spleen, artery, thalamus, testis, placenta, total organ mix, hypothalamus should be repeated after 3 to 6 months. And with premium power cells, short-term but strong, 10 injections in one session, the same cell factors, repeated after 6 to 12 months. Tamara conducted a double-blind study on 10 men suffering from fertility disorders and an infertile woman. Conception occurred in 8 cases of 11. Used for each series of injections were cell factors of testis, ovary and hypofunction of the ovaries, placenta, and hypothalamus. Ovarian insufficiency, our treatment plan is power cells, long-term but smooth, 6 injections per week with brain, heart, adrenal gland, spleen, artery, hypothalamus or thalamus, liver, ovary, placenta, total organ mix should be repeated after 3 to 6 months. Our premium power cells, short-term but strong, 10 injections in one session, same products, repeated after 6 to 12 months. Levander and Bernhardt demonstrated the induction of implanted endometrial tissue on the uterus of castrated rabbits. The specificity of the effect was inferred by exclusionem because implantations of liver, spleen, lung, heart and placenta cell factors caused no endometrial new formations. In 4 test series, castrated rabbits got injections of endometrium from a pregnant rabbit. Regeneration of mucosa with a distinct formation of glands in the recipient was observed. Estrogens were not traced in the tissues. Therapeutically, it is expedient to distinguish between amenorrhea and oligomenorrhea, expressions of functional insufficiencies in the mature age of the woman from the physiological concomitant symptoms of the subsiding ovarian functions in the menopause. Cell therapy does surely more for the menopausal involutionary symptoms and has better physiological and more lasting effects than a hormone substitution therapy. Central tissues for cell therapy to treat gonadal ovarian insufficiency are cell factors of ovary and adrenal gland. Considering the general medical aspects of the outfall symptoms, the selection of organs should have an adequate scope. Hypothalamus, placenta, liver, umbilical cord stem cell factors ought to be used in certain cases too, according to the clinical symptoms. Diabetes mellitus, a factor of risk. Diabetes constitutes a sociological medical problem with respect to its frequency and therapeutic problems. Although the therapeutic conception with the 2 columns, diet and insulin substitution, appears well-founded theoretically, every clinician knows the practical difficulties of long-term treatments. Diabetes generally looked upon as a factor of risk for many other diseases because the vascular and circulatory lesions predispose the organism to other serious affections, for example, circulatory dysregulations, hypertonia, vascular occlusions, infarctions, apoplexia, ophthalmological lesions to the retina, lens, and iris, degenerative lesions of liver and kidneys, disturbed gastric, intestinal, vesical, and sexual functions, degenerative lesions of the skeleton and joints, trophic disorders. The first experimental studies by Dubois and Gonnet proved that injected pancreatic cell factors can produce in subtotally pancreatectomized rats sufficient insulin to normalize the blood sugar. Remarkable in this case and for Alexandre diabetes was the intensive proliferation of the remaining B-cell areas. Our treatment plan for diabetes mellitus is for women and men with power cells, long-term but smooth, 6 injections per week, brain, heart, adrenal gland, diencephalon, liver, pancreas, placenta, stomach, intestine, hypophysis, hypothalamus, repeated after 3 to 6 months, or premium power cells, short-term but strong, 10 injections in one session with the same products, repeated after 6 to 12 months. Compared with these broadly founded experiments, the clinic lags behind. The most comprehensive studies in this field were submitted by Neubert and Stein. Of 179 diabetics that got cell therapy, 94 were evaluated catamnestically. Their ages varied from 14 to over 80 years. In 40% of the patients, an improvement of the carbohydrate metabolism was observed. It ranged from the stabilization of the blood sugar with equal medication through the reduction of the tablets to the reduction of the dose of insulin. The favorable influence of diabetes as part of the so-called revitalizing treatments has been confirmed repeatedly. More difficult are the problems with insulin-dependent diabetes in children and adolescents. Schmidt's experience in this respect is restricted to individual cases of unstable diabetes, difficult to treat in the first 5 years. The metabolism is not stabilized. The requirements of insulin may increase in the first days after the implantation and drop in the second to the third week. For the old age diabetes, the following viewpoint is noteworthy. If trophic disorders and serious changes of vessels are in question, the conditions of absorption for the implantation are often unfavorable, so that a broad, deeply subcutaneous injection are advisable. Revitalization of the skin. We have indications for skin cell factors and 109 tests. Well, on the left side, you'll see the symptoms and then the cases and the proven effects and without effect. You see a lot of different symptoms like burns, scalds, keloids, or ulcus crurus very often, dermatitis by irradiation, hyperkeratosis, acne. Well, you see, acne is, the results are only 50%. We have 4 cases of acne, 2 proven effects, 2 without effects. But we have epicondylitis, 8 cases, and 8 proven effects. Schmidt's experience with large burns and scalds in children made him use skin cell factors suitable for prolonged local application in various skin diseases. This cell factor was chosen to favor the physiological connections between the epidermis and subcutaneous tisular formations and to promote the regeneration of cutaneous lesions also beneath. They were applied IMSC. In cases of extensive scalds, burns, and irradiation burns, the cell factors were dispersed on thin layers of muslin soaked with Ringer's solution. Two multicentric studies were conducted to determine the spectrum of indications. The results of the two tests are represented in the slide, which you can see now. You see, this is a multicentric study from Switzerland and Germany. The Swiss group has 51 tests positive, 5 doubtful, 7 negative. The German group, 41 tests positive, 2 doubtful, 4 negative. And the total is positive results in 92 cases of 110, 7 doubtful, and only 11 negative. The same study, but another indications: hair dystrophy, cutaneous metastasis, and mammary carcinoma, or keloids, or ulcer from the tip of the nose, or psoriasis. You see a lot of indications possible for cell therapy treatment. The total per country was 63 for Switzerland, 51 good results, 5 doubtful, 7 no effects, and for the German group, for 47 cases, 41 good results, 2 doubtful, and 4 with no effects. That means together 110 cases, 92 good results, 7 doubtful, and 11 with no effects. The following indications crystallize for skin cell factors. You have scalds, burns, irradiation burns on the skin, physical injuries, explosion injuries, keloids, hyperkeratosis, antihidrosis syndromes, ulcus crurus, senile atrophy of the skin, trophic disturbances and circulatory trouble, Lyell syndrome, cosmetic lesions, sclerodermia, the scald with hot water, 2 and 3rd degree, and after 3 days, that is after 3 days, and that is after 2 weeks, nearly scarless regeneration of the skin. Scald with hot water, 3rd degree, a course of a week, that is first, and that is after some days, and that is nearly after 1 week. Or irradiation burns on the skin, physical injuries, with hot water bottle and a newborn baby. About 30% by body surface are involved, and demarcation of cold tissue necrosis on the 10th and 13th day. A progressing cleaning and healing after 3, 5, and 7 weeks. And relatively minor scares and recovered functions after months. Or explosion injuries for a gas explosion, condition of admission of hospital, cleaning and rejection of the necrosis on 7th and 10th day, 16th day, and 19th day, nearly complete healing, and 18th month later, skin without scares. Rather problematic, ichthyosis, hyperkeratosis, ichthyosis congenita pictures on the lower leg, and central abdomen after application of skin factors, the hyperkeratosis scales disappeared, something within days. Keloids hyperkeratosis, another case. Serious ichthyosis congenita in 8-year-old girl. Practically all therapies were exhausted. Skin factors brought improvement, but no essential change. Initial situation with injection and implantation of liver and of placenta cell factors. After 5 weeks, extensive scarring and an effect that persisted only 6 to 8 weeks, even after repeated implantations. Rothmund syndrome with downy hair on the begin of treatment after 3 years, development of the hair of the head within a year after 3 years. Or Siemens-Terrain syndrome, first nearly invisible, thinny, downy hair. Condition after 3 years of treatment. Or ulcus cruris with phlegmon in diabetes. Ulcus on left leg open for more than 20 years with phlegmon on lower leg and diabetes mellitus. On admittance, a smeary palm-sized ulcer. Moreover, ulcerations about the size of a piece of money on the inner ankle. After a few days, already astonishing cleaning of the wound, the improvement of which can be followed, is obvious. Or another ulcus cruris. Burn with the remaining ulcus cruris, extensive burn on right lower leg with remaining leg ulcer above the edge of tibia, no healing for 5 months. Then funiculus umbilicalis, after 8 days already complete cleaning of wound so that skin could be transplanted, complete epithelialization, consequently recovery after 5 months of vein treatment with 1 injection of funiculus umbilicalis, observed for more than 2 years. That is 2 years after the injections. Or another ulcus cruris, through wound inflicted in war, most serious ulcer on the lower leg, persisting for more than 30 years, as a sequel of a wound inflicted in the war, and a patient now 63 years old. The patient's general condition had worsened to an extent bad enough to justify the idea of amputation for vital reasons. To this, however, the patient resists because he heard about cell therapeutic alternatives. Injection of funiculus umbilicalis, 2 months. Later, the extensive ulceration appeared virtually clean without any additional surgical measures applied. 3 months after initiation of cell therapy and after a total lapse of 4 months, the leg, which had persisted in a damaged condition continually for more than 30 years owing to a wound inflicted in the war, was completely healed, so that the patient was discharged